back to the Ageless Pet Podcast. I'm one of your hosts, Dr. Carmen Bausone.
And I'm Dr. Gabby Varco.
And this one today, we are going to do part 2 of our acupuncture series. Part 1 was last time where we talked about the benefits of acupuncture, etc. And we talked about we were going to go ahead and do some research basis and look at that as well. So that's what we're going to be doing today.
Yeah, we've got a lot of good articles, and we're going to talk about the articles that show that it's not as helpful in certain conditions, and articles that show that it really is. But it's one of those things that, looking at the literature objectively and also our clinical experience and practice all come into play.
Right, and you will hear a lot of papers rustling in this one because we have a lot of papers on our desk to go over.
We do. We do. But let's jump in. Yeah,
let's do it.
A lot of really good stuff.
Yeah, so obviously the most common use for acupuncture is going to be for pain and for arthritis. So that's what the bulk of these researches are. But we'll throw in the other ones, some other ones as well, just to spice it up and show that there's other use for acupuncture. So the first one was pain management and osteoarthritis. It was a 2007 study, and we're just going to really basically go to the findings and the results. And this one was that acupuncture can significantly reduce pain scores in dogs with arthritis and joint disease by stimulating endorphin release and reducing inflammation. And that's one of the things we talked about last week, and that's one of the mechanisms of how it acts is by endorphin release. So the dogs receiving acupuncture showed statistically significant improvements in pain, lameness, and activity compared to controls.
Yeah.
So...
and there's similar studies in horses as well,
right.
And have actually looked at the beta endorphin release in those and been like, oh, that's one of the mechanisms of action.
Right,
so.
We were talking about that before the podcast, but we don't have that study today. We're not going over that one.
Yeah.
Yeah, that was for back arthritis, isn't that right?
Back pain in horses, receiving treatments versus phenylbutazone.
Right.
And they found that just the acupuncture was beneficial after, I think, at least 3 treatments.
Okay,
yeah.
Cool. Was that in addition to phenylbutazone? Or
no.
Was that, so instead of phenylbutazone?
Yeah.
Oh, that's pretty cool, because phenylbutazone is a pretty strong anti-inflammatory. So
yeah.
Very cool.
Yeah, and then we've got some neurologic condition studies here. So a 1992 study, acupuncture in the treatment of paresis and paralysis in dogs. Paresis and paralysis is they're either weak or they're paralyzed, they can't walk.
Right.
And over 70% of dogs with intervertebral disc disease, which is a bulging disc, herniated disc, showed improvement when being treated with electroacupuncture, which is what we talked about last time, just stimulating the needles with a little machine. Feels almost like a TENS unit when you have it on, so it's not painful or shocking. And electroacupuncture is commonly used in neurologic cases to stimulate nerve regeneration and reduce muscle atrophy, were the result findings here.
Right, I think that's one of the things that in clinical practice, we definitely see that, where you have a dog who is paralyzed or extremely weak, and we can get them back walking again. And I don't think that's uncommon either.
Right, right.
Like, unless they have, well, we can talk about that too, but some of these dogs have been down and have no feeling in their toes. That's a toughie sometimes if they've been down for a long time. But But if they have some feeling in their toes and they're able to empty their bladder, I mean, I'm a go for trying electroacupuncture because I know it works in a lot of the cases. So
yeah.
And then of course you have those miracle ones that do start walking even if they have been down for a while and everything else. But I think us acupuncturists know that electroacupuncture and back diseases or back pain is,
common.
a big one, very common.
On humans too.
Yeah, and it's like so common that I don't even think about it.
Yeah.
And,
it's like a no-brainer.
right, I know, but I remember one of my clients came in and they were advised surgery, and I did all the testing. It did have deep pain, etc. And I was like, okay, let's do acupuncture. And they were like, well, do you think it's going to work? And I was kind of like taken back, like, well, duh, of course I wouldn't recommend it if I didn't think it was going to work.
Right.
But yeah, and it worked, and they were really happy. So, anyways, it's a very common use for sure.
Absolutely.
The next one is gastrointestinal and other disorders. Dr. Alan Schoen in 2001. He's kind of one of the, I'd say, fathers of veterinary acupuncture from way back when. He's great. And this little finding basically was acupuncture can be successfully used successfully in dogs with vomiting, diarrhea, and inflammatory bowel disease. GI points regulate GI motility and reduce spasms.
Yeah, we use it quite a bit for GI stuff.
Yeah, this is interesting though. So, for me, I do a lot of rabbits, and acupuncture in rabbits with GI stasis is wonderful. I can't tell you how many rabbits that I've seen. I've been doing this for 30 years. That before I did acupuncture, I'm like, okay, this rabbit's not going to make it.
Yeah.
And I can't believe how many of these rabbits I thought weren't going to make it, and who do make it, meaning they're going to die, and they do great. So they survive, put it that way,
Right.
and then they go on to live another day, and they do great. But it's one of those things for me. It's a no-brainer for GI stasis in a rabbit. GI stasis is basically people call it hairball, but it's just the gut's not moving and they're not pooping and they're miserable. And sometimes it doesn't work, of course, like everything, but it is a valuable adjunct. So
I think if it's non-invasive and it's easy to
Right.
have somebody bring in their rabbit, I think it's worth a try for sure.
But we have another study. What was the other study with cancer and nausea? What was that one?
Yeah,
Oh, this is it right here, right?
yeah.
Do you want to go over that one since it's in the same? Well, this is cancer-related pain.
So many papers right now. We just have such a stack. Well, they had the one that said nausea and vomiting in early pregnancy, which, equivocal to whether you're
Right.
using B vitamins or antiemetics, which are anti-vomiting. But are you thinking about the canine one? Do you have it there?
Yeah, the canine one with the acupuncture point stimulation for chemotherapy-induced nausea. Or
Oh,
vomiting.
yeah.
And that was the one that showed that the acupuncture point stimulation of all methods combined reduced the incidence of vomiting, but not acute or delayed nausea.
That's right.
It was interesting that it obviously showed that it wasn't 100% effective, but certainly decreased vomiting, which I think is pretty important too. So
Yeah, because then maybe they can use less pharmaceuticals, right? So
Right.
if we can use acupuncture and pharmaceutical, but then finding that lowest effective dose of the pharmaceutical I feel like that's a win.
Right, exactly. So again, some of these studies too that we were looking at some of them were positive, some of them showed
Right.
no benefit, and I think that's real. That's something that we need to look at and accept as acupuncturists, that it's not great for everything, of course,
Right.
but it can be a valuable adjunct for a lot of
Absolutely.
things.
I like this one. It's a 2006 study with post-op recovery and anesthesia, the effect of acupuncture on post-operative pain in dogs following orthopedic surgery.
Mm-hmm.
And it found that acupuncture reduced the need for additional analgesics or pain medications post-TPLO surgery, and dogs had a faster return to function. TPLO is surgery that is probably one of the most common surgeries done out there in dogs, orthopedic surgery.
I think it is.
It's for ACL in people, it's the equivalent cranial cruciate ligament instability in dogs, and so that tibial plateau leveling osteotomy, that TPLO, is very, very commonly done. It's
Right.
$1 billion industry for orthopedic
and
surgeons.
it's a tough surgery too. I mean, it's like the surgeons make it look like it's no big deal because they do
Right.
it all the time, but it literally involves cutting off the front end of the tibia. So it's a bone, so it's an osteotomy, a bone surgery. So bone surgeries tend to be pretty painful.
Yeah.
And then they move the bone and put a plate on there, etc. So there's drilling into the bone. So the importance of this study is the fact that even with a bone surgery,
Yeah.
that the effect of acupuncture is a great adjunctive analgesic technique. So that's
Yeah, and
Pretty
being
cool.
that we do, a lot of rehab here, obviously, we see a lot of TPLO, and,
Right.
and my recommendation is most of the time, if not all the time, like, hey, we can incorporate acupuncture
Right.
in helping the recovery because
Oh,
we
yeah.
know it helps. So
Yeah.
I think that's a great
Well, I'm even
addition.
doing one. I think this patient I've treated 4 times now was a TPLO that was done 2 years ago, and now he's arthritic, and we're doing acupuncture on him, and he's doing wonderful. So
Yeah.
it's a little different because it's not, post-operative recovery and analgesia, but it does speak to arthritis again. And,
Right,
and
like that
way.
first paper you referenced,
Right.
it's beneficial. So we
So
know
that's
that
good.
TPLO dogs are all going to get arthritis anyway, so might as well just start acupuncture after surgery and
know.
then continue it.
I know, but I love the surgeons that act like that's not going to happen. Well, not with my surgeries.
No, it happens regardless. I don't know any surgeon that does that personally, but
I used
I'm
to
sure
know
there's
one.
out there.
I used to know one.
I'm sure they're out there.
He was wacky. Anyways, though, another one here is the use of acupuncture and adjunctive analgesic techniques in dogs undergoing thoracolumbar hemilaminectomy.
It's a mouthful.
Yeah, I know. I don't want to say that again, but so hemilaminectomy, thoracolumbar. So it's kind of where the chest and the back meet, I guess you would say, and that's a real common place for a disc protrusion, and it's probably the most common reason why neurologists end up doing that surgery, to do a hemilaminectomy, which is removing that disc and opening up a space for the spinal cord as well. So, but there was a study. That study showed the effect of adjunct acupuncture on the severity of post-operative pain in dogs undergoing hemilaminectomy because of acute thoracolumbar. I didn't even see that. I read the wrong one.
Right here, the preoperative acupuncture.
Yeah, I read that. What was the result in that study?
Okay, so the result was preoperative acupuncture. So acupuncture before they have surgery may help and improve perioperative analgesia, so pain related to surgery, in dogs with this bulging disc and herniated disc that undergo this back surgery. So basically, hey, we can do acupuncture before, and it may be beneficial in pain management. So why not do it? Because worst case scenario is it doesn't help, but they're getting post-op meds anyway.
Right.
But if it can help, even better.
Yeah.
That's the way I look at it.
Yeah, and this is what the benefit of integrative therapies are, right? So, I mean, would I ever do a back surgery or a bone surgery in a dog that, without pain management? I never would even consider that. But if it could help, then why not do it? Because pain is such a big problem in these dogs, and we know pain can really reduce healing, so it's really important to do that.
Right. Yeah, it's our job.
Yeah.
I'm going to go to the post-op acupuncture is as effective as preoperative acupuncture or meloxicam undergoing ovariohysterectomy. It's a blind randomized study. So basically what this study is saying, hey, you could do acupuncture after surgery, and it's going to be as effective as acupuncture before surgery or meloxicam, which is a non-steroidal pain reliever we use in dogs that are undergoing SPAY, so removing the ovaries and uterus. And basically what they found was they looked at dogs that had it just before, that had acupuncture just after, or needed this pain medication. And across the board, they just found that post-op acupuncture, so after surgery, was as effective as before surgery or meloxicam. Basically, it seems pretty equivocal that they all needed rescue analgesia, meaning they all needed some morphine to help with breakthrough pain. And so it's not saying one is better than the other. They all pretty much seem to need the same amount of pain relief, but they all seem to be fairly reasonable. Now, would I advocate for not using pain meds after SPAY? Never.
No.
But it shows, again, as part of that multimodal approach, like, hey, why not? Let's make these guys more comfortable. And if nothing else, if you do acupuncture before surgery, you might relax them. They might be less anxious. That can always help.
Yeah, but this study actually showed that it was the same as meloxicam. So whether you gave meloxicam or you did acupuncture, these same animals needed the same degree of rescue with more pain medicine. So that's really interesting.
Yeah.
Again, not advocating don't do surgery without pain management, but it is kind of an interesting little thing there.
This one's kind of cool. The laser
laser
acupuncture.
one,
yeah. Because we do laser acupuncture.
Yeah, laser
too.
acupuncture is cool.
Yeah.
Where are we on the back page, huh?
Yeah.
So this was using laser acupuncture for post-operative pain management in cats. So they stimulated, I think it was 2 points is what they stimulated. But anyway, so the result was that, well, first of all, laser, again, is a common thing for pain management. We talked about that, right? So you can treat a whole area, or you can use a very specific point. In this particular one, they used spleen 6 and stomach 36. So stomach 36 is kind of on the outside of your tibia or below your knee. Very common point for pain. So all they did was stick a laser right on that point. So I guess the interesting thing is that acupuncture, at that point would be one thing, acupressure would be one thing, and this is laser. So it's kind of a interesting thing, right? I don't think a lot of people think of laser acupuncture. I do it all the time, but I don't think it's a very common thought. And the post-operative analgesia was required by significantly more cats in the control group compared to the laser group. So the control group, 5 out of 10 dogs needed more analgesia.
These are cats.
Cats, that's right. Cats.
We got to talk about cats in our podcast. It can't be all dogs.
I talked about a rabbit earlier.
You did talk about a rabbit.
And the laser group was only 1 of the 10 cats. So laser acupuncture reduced the postoperative analgesic requirements in cats undergoing ovariohysterectomy. So this was just your common spay, quote unquote, which, again, Dr. Varco mentioned earlier, was removing the uterus and the ovaries, which, we act like it's no big deal, but that's a big freaking surgery.
Yeah, that's huge.
Ripping out the uterus and everything, that's not cool. So it's a painful surgery, usually depending on who's doing it. They're obviously anywhere from a little keyhole incision, but usually like a 1 to 2 inch incision in the middle of the belly and taking out all those things. And trust me, when you're doing the surgery if it's painful or not.
Absolutely.
Their heart rate will go up, etc. Yeah. So it's a painful thing to do, but that's pretty cool that just by stimulating 2 points, it was just as effective, or more effective, I should say, significantly more effective compared to the control group. So that stuff works too. Yeah,
I think that'd be a great, again, if you have time and you're able to do it, why not incorporate these and send home these patients more comfortable?
Right.
And I have patients that don't tolerate needle acupuncture or aqua acupuncture, and I end up just doing laser or a combination of dry needle and laser. Yeah. And I do find...
Those patients are called cats.
I have some dogs.
I know.
But I think it's such a great adjunct. It's a great way to think outside of the box and say, hey, I really want to do acupuncture on this patient, and I really don't think I could do needles, or I can only do a couple.
Yeah, and it's funny, in cats, for me, I always say choose your points wisely, because you only get a few needles, but it's very common for me to use a few needles and then use laser acupuncture on the other points that I want to do. Because some of these points on a cat, down distally below the knees, etc. They don't like that too much.
No.
Not even dogs like that. But,
right.
You stick a needle in one of the toes and you'll find out if a cat likes it or not. And there's a few cats that are like dogs. You can do whatever the heck you want with them.
I have one of those right now. She's just so lovely, and she's like the best patient. I was able to shockwave her, and
oh my God.
I acu her, I chiro her, we massage her. She is just, she goes in the underwater treadmill. She's like the best cat. Yeah, I love her.
That's the cat you want. You should breed that cat. Clone that cat.
This one's really awesome. We were kind of excited about this paper, the 2016.
Oh, that's my favorite.
Yeah. Do you want to talk about it?
No, go ahead. I'll jump in.
This was in 2017, and it showed the effects of dexmedetomidine, which is an injectable sedative administered at acupuncture point GV20. That's on the top of the head. That's like our permission point. And it compared it to dexmedetomidine intramuscularly, which is a common route. We give it intravenously, intramuscularly, and then this one is saying, hey, give it at GV20, which not really a lot of muscle there. You're literally at the point, right? It's the point. And they wanted to compare the sedative effects produced by this injectable sedative in dogs that were given either at this point or in the muscle. Right. And they found that administration of this sedative at governing vessel, or GV20, increased the duration and degree of sedation and analgesic effects or pain relieving effects of the dexmedetomidine compared with giving it in the muscle. Right. So that was really awesome. Yeah. These dogs did have a slower heart rate in the dogs receiving the acupuncture point stimulation versus in the muscle, but the respiratory rate and the rectal temperatures were pretty similar between both. So I think if you do it at this point, you're going to get even more sedation and their heart rate's going to drop, which it drops regardless, right? We all get like antsy and nervous when we see that heart rate drop. Mm-hmm. But it's well known that it's going to drop. It just dropped a little bit more. Yeah,
but I think that's fascinating though, because this drug is commonly used for sedation intravenously and intramuscularly. So this was not either of those routes of administration because that GV20 is on the top of the head, and there ain't a lot of muscle right there on the top of your head. So they're using an acupuncture point, to achieve this effect. And the crazy thing is that, the bradycardia, or the slow heart rate, is a common, I guess you'd say, side effect or an effect. We all know it. So when you see that was significantly more pronounced in those dogs, to me, it just means that it's working better.
Right.
And, that's to me, that's crazy.
Yeah. And essentially you're just doing acupuncture at GV20. And then you get the effect of GV20, the effect of what you're injecting. And I have had some colleagues that swear by this. I've met colleagues that are like, oh, every time I sedate, I do this.
Right.
And they just swear by it. So I just think it's something to think about.
Yeah, and also interestingly enough, too, because if it works as effectively, or in this case more effectively, then does that mean we can use less of the drug, and have less of the side effect? Because this obviously was comparing the same amount, 125 micrograms per meter squared of dexmedetomidine, either intramuscular in the gluteal muscle or subcutaneous in the acupuncture point. So does that mean I can use 100 or less and then get equal sedation and less side effects? I mean, I think that would be pretty cool.
Yeah, and I'm sure it feels a lot better than getting an intramuscular injection in your glute. I mean, for those of us who have had an intramuscular injection in our glute, it does not feel great.
I'm trying to think. I don't know if I'm sure I've had one, but I don't remember.
After I had my appendix taken out.
Oh, really?
Yeah. Oof, that did not feel great.
Yeah. Yeah, so that's a really, really, really cool study of using a drug at an acupuncture point. That's
I like that one. Yeah. And it's pretty recent, 2017.
Yeah, I don't do that a lot, but I need to start trying that and see how that goes. I use low doses anyways, but at the same time you do get that bradycardic effect. So I think that's important. So like I said, so the clinical significance, we already talked about that, right? The degradation. The next one. Oh yeah, so then there was also an interesting study too, gastrointestinal effects following acupuncture at pericardium 6 and stomach 36 in healthy dogs, a pilot study. So those are, PC6 is a point that you'll see all the time, that they have those bands, seasickness bands, is that what they call those? I have some, and I'll use them if I'm going on a rough, rocky trip, but it has it's like a wristband with a little plastic knot in the middle, and you're supposed to put that knot kind of on the ventral part of your wrist, and that's an acupuncture point called PC6, and stomach 36 is well known for stomach points as well, to help the GI tract. So the objective of the study was to quantify changes in gastric and intestinal emptying in conscious dogs following gastrointestinal acupoint stimulation. So basically at the end of that study, it showed that gastrointestinal tract of a dog in dogs was associated briefly with slowed gastric emptying and gastrointestinal transit time. So they used some barium impregnated beads, and they just followed these beads along the intestinal tract to see if it made any difference. So these 2 points slowed the gastrointestinal transit time. Must have been those 2 glasses of wine I had last night.
Must be.
I'm going to blame my wife. She kept pouring. Anyways, though, but that's kind of cool, right? That you can, with those 2 points only, you can slow the gastrointestinal time. So, which, I mean, would that be important for treatment of diarrhea?
Right.
Could be.
Yeah, especially those dogs that have that urgency and they're just going out constantly. Like, if nothing else, you're like, hey, I'm going to do these acupoints.
Yeah,
see if we can help.
Not that this is part of the study, but that's an interesting thing, right? That, like, if you knew those points, stomach 36 and PC6, pericardium 6, which aren't hard to find, by the way. You can find them, on the internet. But it's interesting. It's like, so what if you had a dog that was having diarrhea in the middle of the night? And you're like, oh my God, I'm getting up how many times tonight?
Right.
Maybe massaging those points or doing acupuncture on those points may help
Yeah.
alleviate some of the discomfort for the dog and the discomfort of you because you're not getting any sleep. So
Right.
it's kind of, I think those are interesting things to think about.
Safe and easy.
Very easy. So diarrhea, obviously, probably one of the more common gastrointestinal problems that we see in our patients, so
Yeah.
kind of a cool thing.
Yeah. Also helps with like internal organ function, like kidney disease. There was a really big study, therapeutic effects of acupuncture therapy for kidney function and common symptoms in patients with chronic kidney disease.
There's a lot of dogs in this study.
This is a people study.
Oh, it's a people study?
Yeah, this is a people study. Because this one had almost 1,500 participants. That you don't get numbers like this in vet med.
No.
And it was they looked at a total of 24 studies. About 1,494 participants were included, and they just basically found that acupuncture is an effective and safe treatment for improving kidney function and relieving pruritic symptoms or itching in patients with chronic kidney disease. But obviously it says, but the very low evidence may limit this conclusion. So they're just saying, hey, we need more studies, but we did find that, creatine kinase is one of the values that we often looked at, or creatine, I'm sorry. Creatinine. Oh my gosh, you're rubbing off on me.
Did you drink wine
I
last
did
night?
not.
Okay.
Creatinine. Oh my gosh, I'm thinking orthopedics. Okay, so basically they're saying, hey, we did see serum creatinine levels go down in the patients with acupuncture, which that's one of the main things that we look at.
Right.
So to say that all they did was acupuncture and these levels went down, I think is worth mentioning and worth
Right.
looking into further.
Yeah, this is a meta-analysis, so there was a lot of papers and a lot of studies in there. So, but the fact that it lowered it even a little bit was impressive, to do, because kidney disease is a big problem that we see.
Yeah.
Obviously, we don't see a lot of cats or dogs itching with
I
kidney
don't
disease.
recall.
So maybe that's a human thing.
It might be.
I
I know
guess.
we mentioned it. I was like, oh, I wasn't aware. I mean, maybe.
No
It could
idea.
be an incidental thing where people are noticing their dogs licking more, but I don't recall ever
I don't think that.
having a
make
client
that
mention that when I was managing those cases.
Yeah, I think we mentioned this on the first podcast about acupuncture, but that was one of the papers I wrote, was using acupuncture only. That's the only thing we did. No diet change, nothing else except for acupuncture on the cat. And that cat's creatinine values dropped significantly and maintained significantly. Now, we did do once a week acupuncture, so it's not, for everybody, not
Right.
for every cat, but the fact that was the only treatment and that cat lived for an extra, I don't know if it was 2 or 3 years, it was pretty impressive. So it definitely can be used for that as well. So.
Yeah. And then, we talked last time about the study that came out recently about how, lameness scores in dogs with arthritis weren't improved, but
Right.
that clients said their dogs felt better. So ultimately,
Quality of life.
right. So ultimately, if that's what you get out of it, maybe they're still limping, but they're feeling better and they're happier. And it's non-invasive.
Right.
I know they get the sensation, and it in certain points doesn't feel great, and the dog whips around or something, but ultimately it is non-invasive, and
Right.
it is, with a trained professional, fairly easy. And I
Yeah,
don't
easy
mean
and
that in
safe.
any way, because there's so many points and you
Right.
have to look at so many factors. So it's not like the easiest thing, but as far as implementing,
Right.
it's an easy treatment to implement.
Right.
And just to see that there's literature out there supporting it, that it's been around for thousands of years, I do think it's worth continuing to study the effects, because if people need a more scientific explanation to validate it and presenting that to clients, we do have clients that are very research oriented, and for them to be like, I don't know, and then you can say, hey, look, these studies came out, we're treating this condition, there's the evidence to support it.
And there are studies, we've looked at some of the, we only covered a few of them here too, but I think one of the points to look at or think about is that there's studies that have been done on heart function.
Yeah.
There have been studies on lung function, kidney disease that we talked about, liver disease, cancer pain, cancer general, feeling of, well-being.
Anxiety, allergies.
Oh yeah, that anxiety. You had that big study that you printed out for
Yeah.
the behavior one
Yeah,
too.
it was a 2024 study, and they looked at the efficacy and mechanism of acupuncture in animal models of depressive-like behaviors, and it was a systematic review and meta-analysis. So basically, they had 22 studies with 497 animals.
That's a big one for us.
Yeah, it is.
Yeah.
That's pretty big. With depressive-like behaviors, and they pretty much concluded that acupuncture may treat animals of depressive-like behaviors by regulating neurotrophic factors, neurotransmitters, inflammatory cytokines, and neuroendocrine system. Basically, helps with the nervous system,
Right.
and helps these dogs feel better for whatever variety of different depressive. And we see it with separation anxiety. We see it with other types of anxiety. It's the Shen, right? Like
Right.
the outward appearance and behavior. And you can use it along with certain herbs as well. But if nothing else, like you said, having a client massage, I'll often have people do like GV20 on Shen at home, maybe some Heart 7. That's an easy point on the outside of the wrist.
Right.
And I'm like, hey, if they seem anxious, do all of these things, including maybe a little bit of acupressure, along with maybe some rescue remedy or so many different things that they can try.
Yeah, I'll be honest, full disclosure, I don't use acupuncture a lot for anxiety and depressive conditions, mainly because I do a lot of Chinese herbs, and so I really rely on my Chinese herbs to adjust the Shen and, bring the energy down, et cetera, relief liver stagnation and whatever other problems that may be for the behavior. But it's something to consider to do acupuncture for these behavior problems, because behavior problems are like,
they're huge.
I think every dog has a behavior problem. You know what I mean? So
especially since COVID.
Yeah.
I feel like a lot of, even people will come in saying, oh, this is a COVID dog. Like giving you the heads up, saying like they are super anxious.
Right.
And
because they didn't see anybody for 2 years except for their people. You know?
And then the people had to go back to work and the dogs lost their mind.
Right, and that's a whole different discussion about, separation anxiety, and also about, these shelters being full after COVID again, because they were empty. Remember how hard it was to get a dog during COVID? You couldn't get a dog. It was so hard, and now it's like they're everywhere because people went back to work and dumped their dogs.
Yeah, and that's a very common thing with dogs with behavioral issues, is that they end up in the shelter or euthanized. It's a very common cause of euthanasia.
Yeah, so if acupuncture and or herbal therapies can help, and again, you don't have to rely only on that, but the use of some of these behavioral modification drugs like Prozac, for example, which has been used in dogs for years and years and years, without a training program that goes along with separation anxiety, I think the success rate's like 30-something%.
Yeah, it's really low.
So it's not great. So if you can use Prozac and some Chinese herbs and some acupuncture, again, integrative techniques are really powerful. So, but acupuncture definitely has its place, and I already went on my bandwagon, or my soapbox, remember, about how I think acupuncture research is kind of flawed in its essence, but there's some good studies for sure out there. And if you go on the internet and start looking for research on cancer therapy and acupuncture, immune function and acupuncture, liver disease, kidney disease, gastrointestinal,
and multi-species.
Right.
There's research on horses and dogs and cats
humans,
and humans.
Of course. IBD is a big one that's been studied, and something we definitely do for dogs is acupuncture for inflammatory bowel
There's
disease.
zoo animal acupuncture studies that are out there. There's just so many different things.
Yeah, I was looking it up today, and I saw a little acupuncture study on a penguin.
Oh my gosh.
So
Dare
cute.
to dream.
I know, right?
I know, they're so cute. But yeah, just to wrap it up, we just wanted to present some of the literature out there and just be very open and saying, hey, there's studies out there that say really didn't do much.
Yeah, and there are studies that show that too. But one of the things that just chaps my hide is when people say, well, there's no research on acupuncture, and I have to call bullshit on that, because there definitely is research on acupuncture. And just because in some of these studies, a lot of these studies obviously are done overseas, right? So then people don't pay attention to them because they're not in English or whatever else. But these studies we're talking about are in English, and there's lots of studies, and some of them show it doesn't work for whatever condition. Maybe that's a study design flaw. Maybe it's just acupuncture doesn't work. I don't know.
For that specific condition. But, there's a reason it's been around for how long it's been around, and why it's becoming part of mainstream medical management, where even insurances for humans and animals are covering acupuncture as a therapy, because we show that it helps.
Yeah. I mean, like I said, there's research behind it. So don't let anyone tell you there's no research behind the use of acupuncture. And even in what we see on a daily basis, I mean, I have people, obviously tons of neuro cases that are referred from neurologists, and and I see ones that are referred from internal medicine and oncology, and obviously for pain from surgeons and stuff. So it's definitely more accepted because the research is out there. So
yeah. I agree. I think also if you start to see there are more and more board certified veterinarians that are becoming acupuncture certified, with between emergency and critical care neurologists, surgeons, oncologists, internal medicine specialists, sports med and rehab specialists. Like, a lot of us are acupuncture certified because we see the value in it.
Yeah, and those specialists, they're very science focused. So it's not like a GP like me or some quack like me. It's like, those guys are serious, so they have to have some research behind there. So anyways, though, but we wanted to hit that because that's kind of an important thing. Is there anything else to do there?
No, I think that's pretty good. It's readily available, and if you can't bring your pet to the veterinarian, there's a lot of mobile vets that will offer to go to your home and do acupuncture there. That might be a more comfortable setting, or if you have a large disabled dog that you can't get in and out of the car, or a dog with high fear, anxiety, stress, FAS scores, or is dog reactive and does better in their home environment, just ask your veterinarian for a referral or go online. There's a lot of really wonderful mobile vets that will go to your home.
Yeah, and even if you live in an area that you don't have a vet that's close by, I mean, some of these acupuncture points you can find. There's also, there's this thing called YouTube that has a lot of things out there.
YouTube University.
Yeah, exactly. YouTube University. I was just on it today. But anyways, though, about, acupressure. So even if you couldn't stick a needle in it, you can rub a point, and that can make a big difference.
Absolutely.
So obviously, we like needles. we like to do all this stuff. But I've seen some people who do massage and who do acupressure, they don't usually come in for acupuncture very much because they can do the same thing at home. Maybe more frequently, but they can do it at home.
Yeah.
So it's a valuable thing to do. So anyways, thanks for joining us on our 2-part acupuncture series, and I hope you enjoyed it. And I guess we'll see you next time.
Yeah, thanks for listening.
Thank you. Bye-bye.
Thanks. Bye.